Hey, Dr. Steve Chee here, integrative East-West physician and somatic IFS therapist. One of the great spiritual understandings of our universe is that there is both a form essence to it, and a formless essence as well, a seen aspect and an unseen. And I want to talk about integrating the two in terms of health, because oftentimes this relationship dynamic is not actually thoroughly explored with health. And so it really boils down to that which is measurable and that which is immeasurable. So conventional medicine is very good at measuring things, labs, blood tests, scans, numbers, right? They will give you things that measure whatever that is that they can detect. And the challenging thing is, if it's immeasurable, there are things like our thoughts, our feelings, the subtle energy systems of the body, which by and large, conventional medicine really just doesn't do anything with. And yet, that whole dimension of reality is not actually integrated. And so, I really want to give two specific approaches to this because so the first side is this is how are we utilizing the measurable aspects that conventional medicine gives us? So we're measuring our blood pressure and all of these things. One way that we can begin to look at it is this notion from Carolyn Mays. Your biology is your biography. And to me, this is a contemplative, reflective invitation to start looking at if there is a health condition or health symptom, starting to begin to look at it in addition to addressing it conventionally, but also what is the biography? What's the story? What's the context? What are the relationship dynamics? Where were you in your life when it started to happen? What was going on around you? All of these things impact the biography of it. And and not that we are not that we're victim to this story, so to speak. We are co-authors, with the universe or whatever you want to call that, as co-authors of what the biography is. But part of it begins with looking at um, the story and the immeasurable aspects to what actually is related to the health symptom or health condition. The other side of it is that there are those who are often very, very attuned to the immeasurable aspects of their health and well-being, their thoughts, their feelings, their subtle energies. And yet there can be a deep reticence to wanting to actually engage into the measurable aspects of their health, like seeing conventional physicians. And I really it can be very hard, and I understand that because there's almost like a cruelty or a bluntness to how conventional medicine can come across, since it's looking at the kind of gross physical aspects of our health, and yet it can lack the sensitivity. And yet, so this is to me where sometimes the baby's getting thrown out with the bathwater when it comes to this. But because if we're not looking at the measurable aspects of our health, we could be really missing massive, massive pieces of information. And so it's so important that if we are going to engage into the measurable aspects of medicine, that this is done from a compassionate, from a kind and a non-judgmental place. Oftentimes people don't like it because it's like some type of evaluation, or it feels like they're going to be evaluated or they're going to be dismissed. And there could be, legitimate stories and histories of medical trauma from medical professionals. So the parts that could be sensitive or resisting to it do have very good reason for it. And yet at the same time, if we really want to have a medicine that's reflective of the full capacity, then integrating both the measurable aspects of our health with the immeasurable is truly the way to help broaden a more holistic view towards health. If you found this to be useful, please feel free to comment, like, or subscribe.